and the treatment of viral infection is a very difficult task, as we know that these are the obligate parasites, and these are using the host cell machinery for their own growth and nutrition, also for their replication. So targeting a virus alone is a very difficult task because of that reason. So, and that is to say that when we are targeting the viruses, it also means that we are targeting the human cells or as well, because they will be using those host cell machinery for their growth and for their replication. Okay, and the other thing in addition is that uh, uh, the other hindrance, let's say, for the treatment of the viral infection is because many of these symptoms only appear after uh, I mean to say that many of the symptoms that the viral infection has only appears after it reaches its peak. Okay, and it's very important that we can assess those viral infection in their incubation period, because that will make this treatment much more easier and less fatal. Okay, so therefore the therapy needs to be started into the incubation period for for the prophylactic therapy. You see, but having said that, having known that, like the difficulty in treatment of the viral infections are because them being an obligate parasite, but there are different drugs we have that is already there, which can target, because we know the host cell machinery, the replication so much more effectively, that the drugs are being developed. The drugs have been developed which acts at various stages of the replication of the virus. Okay, so this is to say that the viruses replicate only inside the host cell, and they utilize the host enzyme system. That is, they are the ultimate expression of the parasitism. That's why we say them as the obligate parasites. Okay, and therefore targeting the viruses, only targeting the virus cell is a very difficult task, because they are inside the host cells, the human cells. Okay, and targeting them means also targeting the host cells. Okay, and therefore it invites a lot of inevitable side effects which can even be fatal. Okay, so therefore targeting the virus selectively is a very difficult job. So this kind of antiviral drugs that is targeted against the virus, they produces severe toxic and even fatal toxic effects. So what are they? We'll be coming to know shortly. So you all know that from your microbiology lessons, the viruses have been divided into DNA virus and the RNA virus according to the genetic makeup they have. So these are some of the important viruses that cause important infections in the human population. So our drugs that we will be learning today will be mainly directed for the herpes simplex virus. Okay, and also we will be learning about the drugs targeted for hepatitis B and hepatitis C virus. And in the next class, okay, these are okay, and in the next class, we will be dealing with the antiretroviral drugs, which are mainly targeted for the treatment of AIDS, that is caused by your HIV virus. So I have already told you that why the treatment of the viral infection is a very difficult task. But knowing the viral biology, or let's say the cell reproductive cycle of the virus, is a very important tool to know the different mechanism of actions of different antiviral drugs that is there. Okay, I hope all of you already know this from your from your microbiology lessons. Okay, so I will be only briefly discussing the reproductive or the stages of reproductive cycles, so as to only give into the insight that where the drugs can actually act to have the effect on the reproductive cycle. So first of all, there is a virus. Okay, so there will be a receptor for the virus in the cell surface, which it identifies it. So first thing will be the attachment of the virus into the cell surface through identification of the cell surface receptor. So this can be also called as the or viruses when they are there. So this assemble together to produce a new virion particle, and with the different process like budding and all. Okay, so this will be released. Okay, so you need to know the steps here, because drugs will be the drugs that has been targeted as an antiviral drug will be acting at various stages of this reproductive cycle of the virus. So as I told you, I will be dividing the whole of the antiviral lessons into two. That is, first I will be discussing about the non-retroviral drugs. Non-retroviral means apart from those acting for HIV virus, they are kept as non-retroviral. And if the drugs are targeted for HIV virus, which is a RNA virus, then that is called as your antiretroviral drugs. So in this, we will be learning today for the anti-herpes virus drugs, in which you have drugs like idoxuridine, acyclovir, valacyclovir, famciclovir. So this you'll all get in your textbook of KD Tripathi. Also, we'll be learning few of the drugs for influenza, okay, which is also called flu virus. So anti-influenza virus drug are amantadine, remantadine, oseltamivir, and janamivir. And as an antivirus drugs for hepatitis B, there is a drug called lamivudine, okay, adifovir, tenofovir, and hepatitis C virus, ribavirin, and interferon. So most of these drugs for hepatitis B will come up also in your antiretroviral drugs. Okay, so we'll come to know about that. Again, this is the classification. So anti-herpes drug, I have already said this. And in anti-herpes virus drugs, okay, the category is also there for the viruses named as cytomegalovirus, mostly causing your kind of infections in immunocompromised individuals like retinitis and all that. So these drugs are your cidofovir, ganciclovir, and valacyclovir. These are most exclusively used for the treatment of cytomegalovirus, okay, rather than your herpes virus, because these viruses, anti-herpes drugs, among these are not effective for your cytomegalovirus. This is the same thing. Okay, so first is we'll go with anti-herpes agent, that is the acyclovir. So as the name suggests, they will be effective more of for your herpes infection, both the strains, that is your L1 and 2. So they are effective for both the strains of herpes virus, and they are also effective for other viruses like your varicella zoster virus and Epstein-Barr virus, but they are practically found to be ineffective against a virus, that is the cytomegalovirus. So we have separate category of drugs on under the anti-herpes, which are mainly effective for your cytomegalovirus. Okay, that will be your Acyclovir and all. So coming to the mechanism of action, okay, the acyclovir, the drug itself is a prodrug. So by prodrug, we know that this is the inactive form of the drug, and when they are inside the body, they will be changed into their active form before they can act. Okay, so even the viral enzymes like your herpes simplex virus, thymidine kinase, and or other cellular enzymes comes into play once they are inside the cell. Okay, so they will convert this inactive form of the drug, which is a prodrug, into their active form. First they will be converting it into monophosphate form, and then into diphosphate form, and then into the triphosphate form. Okay, so this will ultimately inhibit the DNA synthesis in the virus, and therefore brings about the inhibition of the viral replication. So this is very easy to remember and very easy to actually uh, kind of, I mean to say, this is like the just simple step is that it is inhibiting the DNA synthesis of the virus, that is herpes simplex we're talking about, and therefore it inhibits viral replication. Is that clear?
Yes, ma'am.
Okay. So as the category of the drugs are mainly targeted for herpes infection, so that this will be obviously will be used for controlling of the infection caused by the herpes simplex virus. So you have a wide variety of infections caused through the herpes simplex virus, right from the herpes labialis to esophagitis to keratitis, okay, encephalitis, genital herpes. Even they are effective for chicken pox also, and herpes zoster. So you can write all the names of the infection caused through the herpes simplex virus. Okay, yeah, it is as simple as that. So coming to adverse effects, we have I have been telling you guys that the infection control with antiviral drugs is very difficult task, and it is related with some of the even the fatal kind of adverse effects, because we know the reason why because we are not only targeting the viruses, but we are also targeting the host cells. So this brings about this invites a lot of fatal kind of toxicities. Okay, so when these are used as topically in the form of creams and all, they will bring about stinging and burning sensation on the area applied. So if they are given orally, they seem to be well tolerated. So mild symptoms like headache, nausea, malaise, some of the symptoms, CNS symptoms means like headache and all is in there. But when they are given IV, they have been found to produce rashes in susceptible individuals. Susceptible individuals means hypersensitive individuals, sweating, emesis, and even hypotension. And one of the important toxicity that has been found to be associated with the use of acyclovir is that it is found to be toxic to the kidneys, to the function of the kidneys. Okay, so they have been found to cause dose dependent decrease in the GFR. Okay, so you can say that these are nephrotoxic drugs. So it is very essential that when these drugs are being taken, okay, this maintenance of the hydration well is a very important strategy to not let this toxic effect on the kidney to develop. Okay, so this is a very uh, pot- potent, okay, nephrotoxic drug actually. And in very higher doses, it has been found to cause some kind of reversible neurological manifestations also, like tremors, hallucination, convulsions, and even coma. So this is at a very higher doses that is not used practically. So that is the prototypical drug in the anti-herpes family. All the other drugs like your fanciclovir, cidofovir, or they have the same mechanism of action, and they will be solely used for the herpes infection. So that will be enough for us to know that acyclovir, being the prototypical drug, they will be representing the whole kind of group belonging to the anti-herpes virus drugs. So the one exception to this category of the drug will be the drug known as Acyclovir, which is apart from which is kind of used for mainly for cytomegalovirus. Okay, so it is an analog of acyclovir, which is active mainly for cytomegalovirus rather than the herpes virus strains. Okay, so mechanism of action is similar to acyclovir, means first they will be converted into their active form, which will then inhibit the DNA. Okay, which will then inhibit the DNA polymerase competitively and bring about the inhibition of DNA replication. So these are kind of more toxic compared to acyclovir, and therefore it is regarded only as a reserved drug, okay, only for the treatment of cytomegalovirus. Okay, so cytomegalovirus usually causes infections in immunocompromised individuals like your retinitis, pneumonia, and gastroenteritis. So since the drug is very much toxic in nature, or they have high systemic toxicity, so the drugs are kind of reserved for the cytomegaloviral infections only. Okay, so by high systemic toxicity means we mean bone marrow depression, and we can imagine how fatal it can be when a bone marrow depression can be there. There can be anemia, there can be thrombocytopenia and all, okay, which can even be fatal. So also psychiatric disturbances like headache, hallucinations, disorientation and all can be there with the drug. So you just have to remember this fact that Acyclovir is the drug which is reserved only for the treatment of these cytomegaloviral infections. So we are over with anti-herpes virus drugs, where we have discussed the prototypical drug acyclovir, and we discussed another drug called as Acyclovir, mainly for cytomegalovirus. So coming to anti-influenza virus, so one of the most commonly used drug for the flu virus, or as an anti-influenza virus, is the name of the drug is oseltamivir, and this is a very commonly used antiviral drug, and it is a broad spectrum antiviral drugs, and it covers kind of every strains or every type of the influenza virus. So there are actually two main types of the influenza or flu virus, that is called as type A and type B. Okay, so influenza A virus can be broken down into subtypes, it has been according to names are given according to genes that they make up, okay, in the surface proteins, like you can say as influenza A2 virus or influenza A1 virus and all. Okay, and upon this type, your influenza type A is more severe, and these are the type of the strains which is more bringing about the epidemics or pandemics. Okay, so type A is more severe, kind of the most severe, and the one which are causing the epidemics and pandemics. So these are covering most of these strains. Okay, so influenza A and influenza B, and also your blood flu, that is H5N1 virus, and swine flu with the H1N1 virus is covered through this drug called as oseltamivir. So this is a very, therefore, a very being a broad spectrum, this is a very commonly used anti-influenza virus drug. So coming to the mechanism of action, so they are inhibiting the enzyme in a virus. Okay, influenza virus, man, there is an enzyme called as neuraminidase. Okay, and this enzyme is important in the viral replication, in the sense that this enzyme is required for the release of the virion or the progeny virions from the infected cells. So this will be checking the replication, because they are inhibiting the enzyme named as neuraminidase, which is required by the virus for further release. Okay, the final step of virus again we have discussed, where after the assembly of the proteins from they will be assembled together and will be ready for the release. Okay, so this release of this replication process, man, last step, so the last step of the replication process will be inhibited by the virus. Sorry, will be inhibited by the antiretroviral drug. So this is kind of well tolerated drug. Okay, no kind of severe reactions or severe uh, or high systemic toxicity drugs. This is not that kind of drug. Okay, so these are kind of well tolerated, so they give nausea and abdominal pain due to gastric irritation. Some can experience headache and weakness, some can have diarrhea, insomnia, and susceptible individuals like hypersensitive individuals can even show skin reactions upon their administration. So next drug is called as amantadine, which is also under your anti-influenza drugs. Okay. So amantadine is actually your drug for Parkinsonism also. So you will be reading a lot more detail about this drug in your class of anti-Parkinsonian, which you will be reading in your CNS plug. But for now, amantadine, which is an anti-Parkinsonian drug, is also an anti-influenza drug also. Okay, and it is a very strain-specific drug which is acting only for influenza A virus, which is called as myxovirus, and this mapani they are working for only the type A2 of the virus. Okay, so as I've told you in the beginning, there are two strains for the two main types, influenza A and influenza B. Okay, influenza B is the more severe one, and Orkokura this type A has been broken down into several subtypes, okay, according to the genetic makeup that they have. The symptoms, the thing is that they are causing similar symptoms like that of the influenza, but according to the type of strains that they make the surface proteins, okay, there is type 2, type A2 and all, okay. So they are practically ineffective for bird flu or that is your H5N1 virus or H1N1 virus or influenza B. They are effective only for influenza A type with the strain A2. Okay, so the mechanism of action has been found to be the antiviral drug amantadine to be inhibiting the uncoating step, that is kind of initial first step of the viral stages of the viral replication or reproduction, and also they are found to inhibit the process of viral assembly, that is almost kind of the final stage of the viral reproductive cycle. So please remember the amantadine, okay, they are found to inhibit both the uncoating as well as viral assembly in the reproductive cycle of a virus. So so the users will be, I have told you that they are mainly used for the strain type A2 of the virus. Okay, so that is named accordingly the surface proteins that they make up, that is type A2. Okay, so they are used in both the prophylaxis, that is prevention, as well as treatment of the influenza A2 virus. So in the beginning I told you that this is a anti-Parkinsonian drug also, so this is also useful for the treatment, as it is also one of the drugs for the treatment of the Parkinsonism, which for the detail you will be dealing it in your CNS block. Okay, upcoming semester, sorry, upcoming class, a block, that is CNS block, you will be dealing with the drug. So here also no such kind of systemic toxicity has been found to be reported for the drug amantadine. So usual kind of nausea, vomiting, anorexia, so CNS side effects like insomnia, dizziness, nightmares, lack of mental concentration. So there also have been a report of the postural hypotension as their side effect, and because of the local vasoconstriction that cause, they can also bring about the ankle edema. So that is about the anti-influenza drugs. So here we studied about the oseltamivir, which is the most commonly used drug for the treatment because it is a broad spectrum kind of anti-influenzaal drugs, which is almost effective for both the types, that is type A, type B of the influenza virus. Okay, so this is commonly used one. So we have another drug called as amantadine, which is also a anti-Parkinsonian drug by nature, but somehow they are effective for the influenza type A2 for their treatment. Okay, so that is your anti-influenza virus drugs. So now coming to the anti-hepatitis drugs, we know that there are two types known for here. So that is your hepatitis B and hepatitis C. Okay, so hepatitis B is a DNA virus, and hepatitis C. Okay, so here for hepatitis B, we have drugs like lamivudine, edifovir, and tenofovir. Okay, so these drugs we will be reading it more detail. We'll be discussing it more detail on antiretroviral drugs also, because these drugs called as lamivudine, edifovir, and tenofovir are kind of first line drugs uh, the um, that we use for the treatment of the HIV virus. Okay, so the drugs are, again, it will be coming in the antiretroviral. So discussing here will be a lengthier version. So I will the whole part I will be summing it up in your antiretroviral classes. Okay, so that is thing. So okay, so there is another drug called as Inticavir. Okay, so this is currently one of the most used first line option for the chronic one. Okay, let's say chronic hepatitis B virus. So here, for mechanism of action, they have been found to cause the inhibition of the DNA polymerase involved in the hepatitis B virus. So DNA polymerase is an enzyme. We know that it is a very important enzyme that is needed for the replication of DNA during the reproductive cycle. So it will be inhibiting that enzyme. Okay, so that there will be inhibition of the DNA replication. So ADRMA, there are a few areas that is to be noted. Okay, like mild dyspepsia, nausea, diarrhea, that they are frequent with every kind of the drugs that is there. Fatigue, distressive, and another thing that you have to remember with the drug is the drug called as the drug Anticavir is lactic acidosis. That too in case of the dysfunctioning liver, like your cirrhotic liver. Okay, so lactic acidosis is the one that you should be remembering as an ADR for the drug Anticavir. So next drug is your Adifovir. Okay, so this again for the DNA virus hepatitis B. So it is going to inhibit the DNA polymerase. Okay, so DNA polymerase inhibit गरेर enzyme responsible for bringing about the DNA replication will be inhibited, so that the replication of the DNA virus will also be inhibited. Okay, so also there is alternative way of acting, is that they can get incorporated into the viral DNA and result in the termination of DNA chain. So apart from the inhibition of DNA polymerase, what they do is that they also get DNA incorporated into the replicating DNA of the virus, so that a faulty DNA strands will be formed and they will be prematurely terminated. Okay, so यसमा पनि the areas associated has been shown, associated area or reported areas for this drug has been the sore throat, okay, headache, weakness, abdominal pain, and flu-like syndrome. So for the hepatitis C, okay, so you have For the hepatitis C, there is the combination of the drug that is most commonly used. Okay, so this is called as your ribavirin. Okay, so ribavirin is given orally, and the interferon alpha, which is called p-glycated interferon alpha, which is given which is given through the injection. So first coming to ribavirin, the drug, okay, which is given for the hepatitis C. These are actually the broad spectrum antiviral drugs, which works not only for the hepatitis C virus, but it has been also found to be work for other viruses like influenza, uh, A and B, and the mechanism of action is found to be related with inhibition of the GTP synthesis in the virus. Okay, so GTP synthesis in the virus here is an important thing in the viral replication, because the GTP is required by the virus to carry out uh, uh, different kind of enzymatic reactions, okay, that is needed to bring about the growth and reproduction in the virus. So it will be inhibiting the GTP synthesis in the virus, which is required for various enzymatic reactions in the virus, so that your survival of the virus is not there, and therefore it is the survival of the virus is not kind of favorable in case of inhibition of the GTP synthesis. Now this antiviral drug is also shows a high systemic toxicity. They are highly systemic, they show high systemic toxicity kind of ADR associated. So they have been found to cause dose dependent, so they have been found to cause the dose-dependent hemolytic anemia. Okay. Similarly, they have been found to cause bone marrow depression. Okay. So that is again kind of a very disturbing and fatal kind of adverse effects related with the uh, adverse effect related with the drug, and also when used during pregnancy to control the influenza or SCV or respiratory syncytial virus, they has been found also to be teratogenic drug. So next drug is the interferon alpha, which is commonly combined with the oral ribavirin. The immunity or the body produces a different kind of cytokines. Okay, so these are actually those cytokines which have been produced inside a human body in response to the viral infection. So these are low molecular weight glycoprotein. So glycoprotein cytokines that has been produced by the host cell in response to the viral infections. Okay, and these are the cytokines that is used. So coming to mechanism of action, interferon alpha or the cytokines, you can kind of keep it as a synonym, like a cytokine, okay, for interferon alpha. So you must have learned in your general pharmacology classes about the JAK-STAT kinase pathway. So do you guys remember about this, the type of receptor, intracellular, the type of receptor called as JAK-STAT kinase pathway? So do you guys remember about this receptor or not? No, the general pharmacology, you have been taught about this. Do you people remember this? Yes or no?
Yes, ma'am.
Okay, so this is the same kind of your receptor. Okay, so JAK-STAT kinase receptor. So the receptor for interferon alpha is your JAK-STAT kinase receptor that is there. Okay, so this interferon alpha, which is synonymously or in the picture has been represented as cytokine. Okay, so this will so that this will cause the activation of the proteins related called as JAK-STAT. Okay, JAK is there. Okay, so tyrosine kinase. These are actually your JAK-STAT tyrosine protein kinase receptors. Okay, so upon coming of the interaction of the interferon alpha on this JAK-STAT kinase receptor, okay, they will bring about the phosphorylation of the, this P means they are phosphorylating the cellular proteins. Okay, so this phosphorylated stat will bring about bring about the phosphorylated cellular proteins, which is called as interferon induced proteins. Okay, interferon induced proteins. Okay, that is the after the activation of this JAK-STAT kinase pathway, when they are phosphorylated, they will bring about the phosphorylation of the proteins stat, which will be bringing about the action of yet another protein called as interferon induced proteins. Okay, and this interferon induced proteins are responsible to carry out various function inside the cell, where they act at different steps of the viral replication. Okay, so they will be inhibiting viral penetration. Okay, so that is kind of after the attachment, the step after the attachment of the virus into the host cell. Okay, also they are inhibiting the synthesis of viral mRNA. Okay, so your mRNA synthesis of the virus is also inhibited. So it also inhibits the assembly of the viral particle and their release. So both the assembly and release are also suppressed or inhibited, and the suppression of protein synthesis is there. So you see, you have to remember the fact that interferon alpha is a receptor. Interferon receptors are JAK-STAT tyrosine protein kinase receptors, which on activation which on kind of activation produce or induce the production of interferon induced proteins, which have different effects on different stages of the viral reproduction, right from your penetration to inhibition of viral mRNA, to the inhibition of the assembly and release of the viral particles, and also the inhibition of viral protein synthesis. So is this clear?
Yes, ma'am.
So this is okay. So again, keeping that onwards, the interferon alpha, it is binding to specific cell surface receptor called as JAK-STAT tyrosine kinase receptor, which on activation phosphorylate the cellular proteins. Okay, and this phosphorylated proteins then migrate to nucleus and brings about the role of a protein called as interferon induced proteins, and this will be affecting the viral replication at various stages. That is, it inhibits the viral penetration, synthesis of viral mRNA, protein synthesis, also the assembly and release of the virus. So these are inhibiting all those steps in the So, okay, so these are used mainly for your hepatitis C virus. Okay, I think I have missed out there hepatitis C also. Okay, so please write chronic hepatitis B and hepatitis C. Ani orco disease syndromes related to virus like your AIDS related Kaposi sarcoma. Okay, so it is only we will be learning a lot about the AIDS antiretroviral drugs, which will be the treatment for AIDS virus. Okay, HIV virus ko lagi. So this is not the drug for exclusive treatment of the AIDS or HIV AIDS, okay, caused by the virus HIV, but it is only used as to treat the Kaposi sarcoma, which is related to AIDS. Okay, these are not the drug for the HIV virus as such. Okay, so next is your condyloma acuminata. So this is caused by a virus named as papillomavirus. So if the other drugs are not working, the gismapani, this has been shown to be a very effective drug. And apart from that, it has been also shown to be effective for herpes simplex virus, herpes zoster virus, and cytomegalovirus in immunocompromised patient. So here we know the drugs are mainly used for the treatment of uh, the herpes simplex. So can you remember the? Can you say the name for the drugs used for the herpes virus? What was the name of the drugs used for the herpes virus?
Acyclovir.
Acyclovir. And what was the name of the drug for cytomegalovirus?
Ganciclovir.
Diacyclovir. Okay, so obviously that these are the main first line treatments for the drug, but uh, in case of the infections in immunocompromised individuals, the use of these drugs alone can be ineffective. Okay, so because these drugs are also having a antiviral spectrum also for this drug, so we can use in addition to acyclovir or jancyclovir for the treatment of herpes simplex or herpes zoster or any other strain herpes infection along with those acyclovir and jancyclovir. Okay, is that understood? So am I clear with this? Am I clear or not?
Yes, ma'am.
Yes, ma'am.
So the thing is, you have to remember interferon is not given orally. So combination is your oral ribavirin is given along with the subcutaneous or let's say parenteral subcutaneous or IM injection of this interferon. Okay. So, adverse effects related with the drug interferon alpha will be your flu-like symptoms. Okay, and these are also very a drug which have a very high systemic toxicity. They have been found to be associated with neurotoxicity, where numbness, neuropathy, altered behavior, mental depression. So, all this has been found to be associated with the use of drugs. Also your bone marrow suppression. Okay, so they have been found to be um, associated with the uses being associated with dose dependent neutropenia or thrombocytopenia. Even the functions of the thyroid has been um, found to be dysfunction. Okay, so now that timro antiviral drugs are they have been most of them is associated with your very disturbing and kind of fatal kind of adverse effects, and therefore we say that the viral infections are therefore very difficult uh, to treat the it is very difficult to treat the viral infections because of the very toxic very toxic adverse effects that it is associated with. Okay, so also they have been in a serious system. Okay, they have also been found to be associated with hypotension, arrhythmias, even alopecia areata. They have been found to be reported for the drug. Okay, and reversible liver dysfunction pani, they have been found to be associated with the drug called as interferon alpha. Okay, so this ends today's topic. Okay, so next class matani we will be dealing with the antiretroviral drugs. Okay, so this is uh, non-retroviral भन्दाखेरि पनि the important area for your antiretroviral drugs will be your antiviral drugs मा चाहिँ नि main चाहिँ नि antiretroviral drugs will be important comparatively. Okay, so त्यो भन्दा having said that, you can't ignore other drugs also, because you can be asked anything होइन जहाँबाट पनि you can be asked about these drugs also, but the much more important area to be covered in the antiviral drugs will be your antiretroviral drugs, which we will be discussing on the next class. Okay. So if so that will be the end of this session. Okay, if you have any question केही नबुझेको छ भने we can discuss.